Hello and welcome to the Pharmacy Informatics Professor 2020 with your host, Dr. Armin Simonian. Social media is a very powerful tool. As we've seen in this first week of 2021 in the events that unfolded on national and worldwide TV, social media can be used in a positive or negative way. I created this channel to try to fulfill a dream, to pass on my knowledge and experience to the next generation, not done for fame or fortune, but really to contribute and help towards the greater good. But as we've seen, social media can be used in both positive and negative ways, and unfortunately, the negative ways can be very destructive. So it's something that we need to keep in mind as we use social media, which has just become so prevalent in this day and age. I'm reminded of an article, a Journal Club article that I had my students on Epi rotation always read and comment on during their rotation, pharmacy informatics rotation. And it's specifically on blogs and basically social media. And this is an article that was written way back in 2010, so 11 years ago. But it came to mind when I was watching the news events, and I thought, you know, it's something that we probably should reinforce. This is an area of pharmacy informatics and something that we need to be mindful of as pharmacy informaticists. Let me bring up my presentation, and I will discuss, starting with the first article that I talked about in 2010, the use of blogs by pharmacists. And in this article, the authors went out and searched for different blogs that were out there that were related to the pharmacy profession. And they reported on what they found. They categorized these blogs into different topic areas. So we had practice-based topics, and then sites that were identifying information, and then sites that used positive language, sites that used critical language, sites that had issues or were displaying professionalism, and then miscellaneous. And then they actually included, this is a chart from the article where they talked about the specific sites that they had found and named them. And as you can see, it's all over the board. We have APHA Chief Executive Officer who had a blog. Remember, this is in 2010, so I'm sure a lot has changed. Ask the Pharmacist, so consumer education or information. Diabetes Pharmacist, again, consumer education. Telepharmacy blog, a specific pharmacy informatics topic. And then we get into kind of the other side of the fence, which is the angry pharmacist, the politically incorrect pharmacist, your pharmacist may hate you, blog site. So you see that it runs the gamut, and both on the positive and what I'm going to say on the negative side. In 2012, ASHP came out with a statement about social media, and I think it's great to go back and review this and really give some thought to how we use social media, especially as health professionals. So if you read their conclusion, this is verbatim right out of the conclusion of this statement, which was actually put together by the section of Pharmacy Informatics and Technology and then approved by the General ASHP Board of Directors. But they talk about social media as emerging as an important mode of communication, and increasingly being used for professional, personal, and business communication, as well as patient care. So they're saying, as medical professionals held to high standards of personal, professional, ethical, moral conduct, pharmacy professionals have a responsibility to use social media appropriately. So I'll just leave you with that thought and leave it up to you to go and read the full statement by ASHP and maybe go back and look at that first article in 2010 and other articles that have been printed on this topic. And you can form your own opinions, and just keep in mind what we're here for, which is really taking care of our patients. If this was helpful to you, please like the video and subscribe to my channel, and I'll thank you for that. And in the meantime, stay safe, stay healthy, look after the health of others. I'll continue to work on more Journal Club and other episodes for this channel, and I hope to see you next time. Take care.